بسم الله الرحمن الرحيم. Lung collapse or atelectasis. The definition: collapse means acquired deflation of the previously inflated lung. Atelectasis is incomplete expansion of the lung at the birth. The two terms are used interchangeably. Causes of atelectasis. First cause is prematurity, which causes hyaline membrane disease and leads to decrease in surfactants. The second cause of atelectasis is congenital bronchial obstruction. The third cause is respiratory center depression by sedatives given to the mother. Causes and types of collapse. Obstructive collapse, which sometimes called absorption collapse. Bronchial obstruction will lead to absorption of air in the corresponding area of the lung tissue. The oxygen is absorbed into the blood at a faster rate than it's replaced. And the cause of obstruction collapse include intraluminal or intraluminal obstruction, such as foreign body or secretions, and bronchial obstruction due to problem in the wall, such as bronchostenosis or tumor, and bronchial obstruction outside, such as enlarged lymph node or mediastinal mass. Then the second type of collapse, which is non-obstruction collapse. Non-obstruction collapse include compression collapse, which related to pressure or passive or relaxation collapse. Here there is something presses on the lung, such as pleural effusion, pneumothorax. The second type of non-obstructive or non-obstruction collapse is adhesive collapse, which is due to abnormal lung surfactant, such as what's happening in hyaline membrane disease, which is neonatal respiratory distress syndrome, usually occurs in premature infants, and adult respiratory distress syndrome. The third type of non-obstruction collapse is cicatricial collapse, collapse due to pulmonary fibrosis. Fibrosis will cause stiffness of the lung and will lead to decrease in lung compliance, and the volume of the affected lung is reduced. Now I will speak about the clinical picture of lung collapse. Symptoms include dyspnea, cough, and clinical picture of the cause. And the signs of lung collapse include signs during inspection, and signs of palpation, and signs of percussion, and signs in auscultation. Inspection. What we'll see in inspection, diminished movement of the affected site and chest wall retraction on the affected site. And impalpation of the lung will find diminished tactile vocal fremitus and mediastinal shift to the affected site. And in percussion, there is dullness over the affected site, and in auscultation, there is diminished breath sound intensity. What are the complications of lung collapse? First, there is recurrent pneumonia and lung abscess. Second is fibrosis. Third is bronchiectasis. Fourth is respiratory failure. Investigations of lung collapse. Investigations of lung collapse include radiology. Second is bronchoscopy. And third, investigations for the cause and for the complications. Radiology investigations include chest X-ray. We can find area of homogeneous opacity over the affected site and displacement of fissures, crowding of bronchi, raised diaphragm, crowding of the ribs, mediastinal shift towards the side of the collapse, hilum shift up or down toward the side of the collapse, and the compensatory hyperinflation of the normal lung. Bronchoscopy, diagnostic to detect the cause, such as foreign body or tumor. And we can use bronchoscopy as a therapeutic tool to remove foreign body or secretions. Investigations for the cause and for the complications include high resolution CT. What is the treatment of the collapse, of the lung collapse? We should treat the cause. We can do bronchoscopic removal of foreign body or secretions, and we can ask the patient to do breathing exercise, and the treatment includes also oxygen therapy and prophylactic antibiotics. Now we will speak about acute postoperative massive collapse. The etiology of acute postoperative massive collapse include lack of good preoperative preparation, general anesthesia in presence of chest infection, neglected aspiration of secretions during and after surgery, inadequate cough or chest expansion postoperatively due to pain, aspiration of vomitus due to full stomach at time of anesthesia. The clinical picture of acute postoperative massive collapse includes symptoms. The symptoms include sudden onset, 24 or 72 hours after operation, of dyspnea, cough, wheezy chest, and signs are the same of we find in any collapse, include inspection, palpation, percussion, auscultation. In inspection, there is diminished movement of the affected site and chest wall retraction on the affected site, and in palpation, diminished tactile vocal fremitus and mediastinal shift to the affected site, and in percussion, there is dullness over the affected site, and on auscultation, There is diminished breath sound intensity. Treatment prophylactic avoid predisposing factors. Therapeutic treatment include bronchoscopic removal of foreign body or secretions, breathing exercise, oxygen therapy, and prophylactic antibiotic, and the early mobilization of the patient. Postoperative pulmonary complications, cause of dyspnea after operation, will include aspiration pneumonia, aspiration lung collapse, acute respiratory distress syndrome, pulmonary embolism, postoperative collapse, pneumothorax. And that's all. Thank you.